So broadly, what
yes.
subspecialty did you choose?
So I did join 6 months in Sagar for an SR job, and then I realized, like I said, I somehow got too much involved with my patients. A lot of bad cases we had seen, and I'm like, somewhere in my mind, I'm like, I need to do something. And post that, one of my professors was head of the department in PES Kuppam. So he said, why don't you come? And I think he had very few doctors under him. So he said, why don't you come? And he was a fantastic doctor in vaginal surgeries. And I had a great passion for vaginal surgeries. I thought it was like no scar and very good and a lot of things. So I went there, worked in Kuppam for like 6 months, picked up a lot of skills because we didn't have help. It was like a very remote place. I would say like a taluka place, and limited resources, though the hospital had everything. But to take care of the patients, I think needed a lot of things. So I picked up my surgical skills quite well. And we had just one boss. So you get to do a lot of it. Incidentally, I decided I should do something else. Though I was not sure, do I do minimal invasive surgery or do I do infertility? Do I do oncology? I was not sure. And as days passed by, I think there was an entrance exam in Rajiv Gandhi University for infertility fellowship. So I just written an exam casually. Like I said, not that I was a great student, but then I think love with the subject makes you feel you want to learn more and more. Luckily, I got through, and I was the second student in the Rajiv Gandhi University. So I ended up getting my fellowship in infertility.
Very nice.
So again, I had a wonderful mentor. So I still tell her she's the mother for my professional life, and she's really taken care of me.
Very
and
nice.
I've learned a lot from infertility.
So since then, you've been practicing infertility.
Yes, I've been practicing infertility. And as days have passed by through these years of 19, 20 years of my practice, I ended up, post my fertility fellowship, I ended up working in a corporate hospital, that's Narayana Health Hospitals. And had started my career. Luckily, touch wood, I always call myself lucky. So, not much of breaks. So I ended up getting a good job there. So I was taken as a junior consultant immediate my fellowship, and I wouldn't mind saying I'm a quite aspirant person. So I went to Dr. Shetty and he said, I'll give you a JC post. I said, you're giving me a JC post? I'm a fellowship in fertility. I'm here to set up a fertility lab for you, and I'm not coming here as a JC. He said, 6 months and then we see how you work. At that time, we didn't have a labor room. They were just doing elective sections because it was a great cardiac center. And a lot of high-risk patients were coming. So we already had somebody working there. So I took that as a challenge, set up the labor room, and we got DNB students there. So that was the kind of deliveries we were doing, just two of us. And then we increased the department numbers. And that is when I was offered to start the fertility lab. So we started our fertility lab. I set up at Narayana Health Hospitals going on. And incidentally, we had a robot. So Da Vinci robot came into Narayana, and again, Dr. Shetty is somebody who's very technically, very forward thinking. I would call him as a visionary. And then he called me one day and he said, I want you to start doing robotic surgeries. I was telling him, I'm not trained in robotic surgery. He said, doesn't matter. I know you. You can pick up things very well. So you start today. I said, today? Are you joking with me? And I think we had literally an hour of argument there. And he said, we had two surgeons who were trained in robotics. So he said, the surgeon and a urologist is going to help you. And I'm very obsessed with my patients, and it's just that I have to take care of them and a lot of things like this. I said, why would a surgeon operate on my patient, or why would a neurologist operate on my patients? I'm going to take care of my own patients. And then he said, then this is the day. There were simulators, so we went, picked up. I sat on the simulator for 2 hours, and I think that day I'd posted 13 cases or so. He said, I want you to call me at the end of a day and tell me you started robotics. And this is how my robotic career started.
Very nice.
And yeah, beautiful journey. I still continue to do a lot of robotic surgeries. I think I finished around 700 robotic surgeries, all kinds of surgeries in the last 7-8 years or so. And going by, every time I think there's a patient walking in, I realized post-delivery, a lot of people had vaginal laxity, And as the age process was increasing and a lot of body physical changes, and I thought, we should do something about that. That's how I did fellowship in cosmetic gynecology.
Mm-hmm.
And because I was doing my infertility, we had a lot of patients coming with low AMH, lot of problems conceiving with fertility, though we had treatment modalities in infertility. I said, no, I'm going to do something. And then I did fellowship in regenerative medicine. And I was in Cancer Institute for quite some time. So I was seeing patients where they were getting diagnosed with cancers, but then the cancer treatment was so good, they would end up living for a longer duration and nobody were addressing their reproductive need.
Mm-hmm.
See, once you go through a chemotherapy or you go through a radiotherapy, especially we are seeing a lot of childhood cancers these days. And then I was realizing they were alive to be on the reproductive age group. They were getting married, but the sperms were gone. The ovaries were not working because nobody had touched on those topics. So that is when I realized there's a gap here and I need to go learn and help my patients. So I went to Denmark. I learned on ovarian tissue cryopreservation, fertility preservation. So I'm here doing a lot of things. So
Very nice. You had multiple points
Oh,
of
yes.
inspirations, and you
Yes,
pursued
yes.
them all to
Definitely,
build
definitely.
it
And
up.
I
isn't
think
it?
this inspiration has always been my patients.
Very nice.
And
So
then-
currently, where are you working?
I am in the transit.
Mhm.
I have worked in Kaveri hospitals and Cloud9 for quite some time, 2 years each though. And I'm in a transit now. I'm going to be the lead consultant and the senior consultant at KIMS hospitals. There I'll be heading their fertility unit as well, and that will be called as KIMS Lakshya Fertility, for which I'm the clinical director.
Very nice. Very nice. Are you working on any other projects simultaneously?
Oh, yes, lots of it, I would say. And like I said, I'm very passionate about women's health. I simultaneously love educating people, and somehow I feel knowledge shouldn't go to grave without being, spread.
I agree.
So I do a lot of these academic works where I talk to my own peers and get them, like, I've been qualified with so many degrees. I inspire them as well, like, look, you'll have to do this, do that. And we get a lot of observers, young doctors coming, trying to understand about robotics, laparoscopy, cosmetic gynecology, regenerative medicine. Along with that, I reach out to communities on cervical cancer screening, like simple things like pap smear. When it is done, you can pick up cancers almost 10 years earlier.
Mhm.
I also work closely with a lot of societies where a lot of doctors do these voluntary jobs. Not just me, we have at least another 1,000 or 2,000 gynecologists just in Bangalore volunteering for community work. So we all take turns to go do breast cancer screening, pap smear screening. We talk about HPV vaccines. And now, Bangalore traffic, it's like you can't keep meeting people. So for our own peers, we connect on the online platforms, and then we talk about how do we solve issues, vaccinations, and if somebody's used it for a longer duration, we talk about all the advantages, disadvantages. So a lot of community work goes on as well. And I'm a part of Rotary as well. So I'm the clinical co-director for maternal and child health for the district. And then I've been doing a lot of medical camps, and I somehow like reaching out to the rural sectors where we should help. And when I say we reach out to rural sector, it's not about just gynecology. I have wonderful friends. So we do a lot of ophthal checks. We get the eye surgeries done, and lot of people contribute. Even if it's gynecology, I have wonderful friends who are always ready and volunteering to come over anywhere, and then we spend our Sundays with these kind of people. So
Very nice.
yeah.
Very nice. That's so many things you told me about now and that you're involved in. How do you manage it all? How can you describe me your day? When do you start? How does it go? And how do you end?
My day is like occupied 24 hours, I would say.
With so many things, maybe you'll fall short of hours there.
Yeah, I would love that if that day had 48 hours, but I think it's how you utilize the 24 hours.
So how
I
do
think
you do it?
makes a difference. I'm not a very early morning person, but inevitability, I don't like fighting with my colleagues for OTs. So I know everybody likes starting their day by 9. So I start getting my OT slots much earlier, by 6:30 if I have a surgery, or 7 o'clock I'm in the OT. Finish my surgeries. My OPD generally starts by 10 o'clock. So I like to have an undivided attention. I love my patients. I just want to sit with them and talk to them. So I finish my procedures preferably before 10, and 10 to afternoon, and then you take a half an hour break, and then we restart our evening OPD. Of course, deliveries, we are at the mercy of the nature. They
Mm-hmm.
happen at any time. Evening, if there are anything, we reschedule. So throughout the day, anywhere between 30 patients to it goes to 60, 65 patients of the OPD. So we run the OPD. All my academic work is done mostly on the Sundays. And my OPDs run till 8 o'clock, 9 o'clock. But then I feel really good because my energy comes from my patients. And every smile, every infertility patient, when they come back and show me their beta HCG values or their two lines that I get to see, it's like, oh my God, you should see the joy in the OPD, including my staff, my secretary, even before the patient comes, like, Madam, or pregnant
Is
aap
it
idhar hai?
positive?
It is like this because it's like literally, I feel you are through the journey of the patient. We see their up and down and their emotional traumas that they go through, and there's so many things. So I feel you get involved in their story and you become a part of their life as well. So I sometimes feel I'm rejoicing more than them. So that's how it is. And yeah, then even in pregnancy sometimes it's not smooth. So there's a lot of
There will be
things
up
which
and down.
goes
It is
on. Yeah,
always a
yeah,
roller
yeah.
coaster ride. It's,
And I have patients who come with their little babies and these cute little kids coming in to just say hi and we were here. So that makes you feel really good.
that's nice.
And
And as I
yeah,
say, when you love doing what you do, there is not much stress there. But
definitely,
of course,
definitely.
it does take a toll physically and mentally and things like that. How do you stay grounded? What do you do for yourself?
For myself, see patients. I would say that because I'm not sure any day I've felt that this is causing a strain on me. And I've never felt like this is not something that I should be doing or I should give up my subject and I don't like this. I don't think I've had any day. Maybe at just at one point, like I said, my pregnancy a little up and down I had. Maybe that's when I said, when I'm not doing justice to my own self, how do I take care of somebody else? And I think I really love and respect my dad. And then he would tell me, what you've gone through, nobody else should go through. This is how you should be working, that every woman who comes to you should be happy and they should get what they want. And I think that is what was my changing moment. And I feel that's when I fell in love with women and how to take care of themselves and how to help them. And that's what helped me. And what do I do for myself? Like I said, other than seeing patients, where I get most of the energy, I would say, I love my coffees.
Nice.
So, morning, I try and make that 10-15 minutes. I sit in my garden to sit and sip that coffee.
Have some
And
me time and
oh, yes, me time.
yes.
And I have a husband who is very, what I would say, like more conscious on physical health. So he would push me to do a lot of things. If you leave it to me, I would just eat, sleep, and see my patient. That's what my day would look like. And because of him, I think we do get into quite a few, little bit of exercise, though he's doing a lot. And my son's also good with a lot of workouts. So somehow they both push me. With great difficulty, I do exercise. It's not that I love it. Like I can see the patient's entire 24 hours if you leave me. That's how my day goes. Otherwise, a little bit of meditation. Everything's a little bit. What I like most is when I go for my academic talks, which I travel quite a lot across the world. I really love exchanging knowledge because you get to see what is the newest technology which is available. And I love bringing that back to my country, bringing it back to my own people and implementing and trying to make sure even our patients get the utmost of the treatment. So with this work, I also take a little bit of vacation for myself, where it is either an extended day prayer or later, and I love to call it as workation. So it's a work plus vacation, so I would call it as a workation. So that gives me quite a lot of sometimes break, and sometimes my phone goes ringing nearly 100 calls per day, and though I don't give my numbers to the patients, inevitably you end up seeing a lot of text and these things. So those are my relaxed days, and I come back with full energy to see
Very
my
nice.
patients. Yeah.
So much of dedication has gone into it and so much of time that you put in. Is there anything that you miss that you wanted as a child, that you wanted to pursue something and then now because of all these commitments and dedication that you lost out on it? Oh, if only I'd done that thing, I should have kept it alive. Any
I
hobby or
I don't think much about it, but yeah, now that you ask me this question, I'm wondering what do I like as a hobby or what did I do? I think playing Veena is something that I miss. I'd learnt it for quite some time, I think because of the medical career and the dedication that needs for studying or your patience and a lot of things. I think that's something very forgotten for me. So, yeah, if time permits, I think I would go back to be a student again and restart because it's been quite some time. I wouldn't mind saying 2 decades nearly.
That's
So
nice.
maybe I have to relearn everything, and yeah, maybe that's something that I want to pick up.
Very nice.
Yeah.
Very interesting. Now, you said you've been traveling around and then you have this exchange of knowledge sort of a thing, and you picked up so many things abroad. And what do you think is lacking in our country that you would desperately want to bring it?
I never like putting India down. I love my country as well, and I would say we as Indians, we are much better than anybody else in the country for the jugaad. Even smallest things we can
Yeah.
put up, we can implement it very well.
Sure.
And our patients are also quite adaptable to all the solutions that is available. It is just that I think I wouldn't say just the government or private health sector. Costing sometimes I feel does play a role because not just India, I wouldn't want to talk about my country, though it's just that even in my practice, I think I have all kinds of sectors of patients. I would say 50% is coming from the middle class, and then we have almost 30 or 40% coming from the lower class, and then maybe 10% or 15% is from the real niche. So it doesn't matter for them what's the cost. They just want a procedure done, and it's like, I would have patients come in like today, can you do the procedure for me now? I said, no, we have a protocol to follow. And cost is not a problem for them. But then I'm worried about that 70% of the people who walk into any OPDs, because I think as India, whatever we call, we are a developed country, or I think financial things and health sector makes a lot of difference. Though we have people talking about a lot of things being available in government hospital, I'm little afraid patients don't use it. I wouldn't say government hospitals don't have the facility. Definitely, they have a lot of facilities. Quite a few occasions have met the health minister. We've had a lot of chats, and I realize there are a lot of things. Very good qualified doctors, even in the government sector. Government hospitals do have laparoscopic surgeries. Just I think 2 days back, I read fertility is going to be started in government hospitals. Government is definitely working towards getting all the technology even to the unreachable or even to the lower class of patients. My fear is patients are not reaching out. Patients are not utilizing what is available. They do beautiful high risk pregnancy deliveries, cesarean sections, like I mentioned, laparoscopic. Now, very soon, maybe in a year or so, we'll have fertility services available in government hospital, even coming to an NICU. We have lot of, like, I think even in pregnancy, for quite a few reasons, people are postponing their pregnancy. We have quite a lot of elderly patients becoming pregnant, lot of high risk because of that, diabetes, hypertension, they throw up a fit, and a lot of cardiac issues. Even conception is a problem that's to do with fertility. Even these pregnant patients, they had treated very well in government hospitals, because these government hospitals, I have quite a few of my own friends, and this is how I know they're doing wonderful job there. I think government should also be talking about the real facilities, like how a corporate hospital would picturize saying what is the facility available. I think the doctors as well as the government together, when they start talking the facilities that has been there, and like how in a corporate hospital a patient would talk about what they went through. I think if we start doing these small things, everybody in India is going to be healthy, and I will not say this is something that we lack. Even though we are such a big country with so much of population, I feel each one of us can have access to healthcare very beautifully. I think.
Very nice. Very nice. Technologically and advances in your particular field, do you think we are on par with the rest of the world? And
Yes,
we have everything.
100%.
We don't have to go
100%.
out or.
No, no,
That's
I
nice.
don't believe. This is why, like I said, I've been lucky. We travel across. It's just that you need to have the heart to bring it back and make sure you stay with your country. And I've always believed, I don't think different countries have had the magnet to pull me outside India. I've always felt whatever knowledge I have gained, I feel we need to serve our own people. I don't believe in going to some other country and serving them. Of course, as a holiday, I would enjoy going outside the country. But then when it comes to work, I've always felt that I need to take care of my people, my country, my this thing. I think I've had a little obsession of staying back here, though we've got a lot of opportunities. So this is why I travel, pick up a lot of things during the conferences, academic sessions, and I feel we should implement. And I definitely know for sure India has the money to do it. And luckily, because of the corporate hospitals, we've been able to implement. And I don't think health sector is anyway below other countries. I would in fact say healthcare in India is the ultimate best across the globe. And I can challenge it outright,
I won't
including the
contest it.
doctors.
I won't contest it at all. I'm convinced with that.
Yeah, yeah.
Very nice. So many things you learned and so many things you brought in, and you're so inspiring. You've done so many things that is reaching out to the public, raising awareness. Thank you so much for telling about
Thank you so
your
much.
story, your journey.
It was
Thank you.
wonderful chatting with you.
Wonderful. My
Thank you for
pleasure.
this opportunity.
My pleasure.